Welcome to the Home Health Minute, your monthly podcast brought to you by the Home Health section of the American Physical Therapy Association. Hosted by Troy Mead. Hey everybody, and welcome to the Home Health Minute. Before we get started with Karen Yong, I have an exciting update to the upcoming podcast. This was initially recorded a few months ago, and we talked to her about her team's upcoming presentation at CSM. Since the recording, Ken Miller has replaced Mary Marchetti due to obligations and availability. Also, Karen mentions an article that the team was submitting for publication. Well, that article has been accepted for publication with Home Healthcare Now. There isn't a release date yet, so keep your eyes open for that article. Now let's get to the interview. Hey, hello, and welcome to the Home Health Minute. Today I've asked Karen Yong onto the program to talk about her upcoming presentation at the CSM this year. Hello, and welcome, Karen.
Hi. Thank you for inviting me.
Thank you for joining us. I appreciate it. Before we get started, can you tell us a little bit about yourself and your team that you're presenting with?
Sure. I am a physical therapist with more than 3 decades now of experience, with over 20 of those in the home health setting. I'm passionate about spreading what quality home health physical therapy is all about. And with that in mind, I've joined the practice committee for our home health section and been the task force leader in getting our value project off the ground. That was a House of Delegate project that they wanted every sector of the continuum to be addressing about value. So I brought this back to our practice committee, and we have a task force now working on this project. Our value statement was actually approved by our home health section membership last September, and now we are moving forward in submitting an article to a peer-reviewed journal. And our last piece that we submitted for presentation to this session for CSM, and my project, other members to this project that's currently working with me on our CSM presentation is Mary Marchetti, Jason Falvey, Tracy Collins, Brian Booth, and Ken Miller, who is our practice committee chair, will also be a panelist and has been helping us as a task force member on this project. The title of our presentation for CSM is called The Value of Home Health Physical Therapy. And what we really wanted to be able to share with our audience, how did we come about the value statement itself, but truly to share with our home health PTs out there how they can view themselves and be able to express to others around them what is the value of home health PT and what is their role in the home health continuum at this point. In view of the lots of the changes that is going on coming up in 2020, we want that evidence-based clinical decision-making for our clinicians and be able to express and put into words our outcomes and how do we integrate that on return on investment.
The focus on value, I know that's very important, especially with all the different CMS initiatives that are running around right now.
Absolutely.
How do you think the home health clinician is going to benefit from the presentation?
Right now, most of us that are in the home health setting, we understand the value of what we provide anecdotally. But I don't believe that there is a lot of research out there that we can quote or to really express how do we tie this all up. And so with this presentation, we want our clinicians working out there to have that piece. What we're going to look through all of the evidence and give it to you and show you, what is that knowledge you need in order to justify the care that you are providing, and that we are absolutely necessary to have that outcome for not just our quality care, but the patient's perception. And how do we then pull this all together and be part of that triple aim, which is why our value statement is so important. We are trying to substantiate how do we collaborate with the triple aim.
And the triple aim is based in value that we bring. Is that correct? Is that
Correct. Correct. And the triple aim, if folks are not familiar with that, it's about home health role in population health, our outcomes and costs, and the patient care experience. So that's what we are trying to justify.
What's the most exciting thing you're going to talk about?
I collaborated with Ken Miller, our practice committee chair, and we thought that the most exciting thing that could come out of this is really the financial piece. I mean, we know our value, but do we really understand the financial piece? And how is that relevant to home health PT and tying it to our outcomes? So, and then giving a concrete examples of a matrix of a large healthcare system. So we're going to be trying to provide all of that during our presentation.
Yeah, I think that's important because I think it's hard, especially if you're in the day-to-day of working with your patients, I know you know that you bring value, but it's hard to, like you said, harder to quantify that or even, bring that to the table to others who may be talking around the triple aim. What can we expect to learn from the presentation?
So what we are hoping to do during the course is to define for you what the value of home health physical therapy is, and then to hopefully give you that knowledge on how we will then enhance the population health, as well as how we contribute to quality outcomes and cost savings. And then ultimately, how do we benefit our patients in their patient care experience.
Thank you, Karen, for all that great information. I hope everyone else is excited as I am to hear more about this at CSM. Again, thank you for your time, and I'll see you at CSM.
Thank you so much, Troy. Looking forward to it.
Thank you for listening to the Home Health Minute, the podcast from the Home Health section of the American Physical Therapy Association. Check out our website at www.homehealthsection.org. There you can find links to this episode, tons of helpful resources for your practice, and how to connect with us on social media. Thanks for joining us, and we'll see you next time.